Hey everyone, Dr. Tam here. So I just want to let everyone know about this amazing website and features that is on this website because we had a patient yesterday that came to me that says, Dr. Tam, I have my doctor hasn't really checked my medications, and I felt like I'm getting, muscle soreness, muscle aches, and just all the different things that they were telling me. They're bruising really easily, they're losing their balance. And I said, what kind of medications are you taking? They're like, well, I have a whole list. I said, well, that's wonderful. Has your doctor or pharmacist ever cross-checked these medications to see if there's potentially any adverse side effects or any problems with the interactions of medications or the side effects of medications? And they said, no, no one's ever checked it for me. It's been about at least 10 years since everyone's looked at them thoroughly. And, I don't know where to go. And I said, well, why don't you bring me the list of medications and I can take a look at it for you. Because I know there's certain medications that have side effects, right? And well, all medications have some sort of side effects, but they also interact differently. So I went over about 5 websites, WebMD, RxList, drugs.com. And drugs.com seems to have one of the best interaction reports, drug interaction reports. And this is something you can find online. It's on drug.com. And I recommend someone to do this because when we looked at this patient's medication, and this is the list of the patient's medications. Overall, you've got drug interaction reports, right? I've listed all the 11 drugs that this patient was taking. And when you look at this, overall, here's some major, and this is major. They listed in major, moderate, minor, food interaction, therapeutic duplications. So the major is in red because it's a big problem. For example, okay, these first 2 drugs, one of them is a statin drug, okay, and fenofibrate along with the rosuvastatin, okay, and the fenofibrate. What's happening is with these 2 interactions on drugs.com, if you read about it, it is increased side effects such as liver damage, rare but serious condition called rhabdomyolysis that involves the breakdown of skeletal tissues. And as you start reading, well, it can cause unexplained muscle pain. Immediately let your doctor know if you have unexplained muscle pain. And that's a lot of people come to us for muscle aches, muscle pain, musculoskeletal problems. Tenderness, weakness while taking these medications, fever, joint chills, nausea. And that's just the first interaction. Then once again, right down here, there's another one. This is major as well. Okay. Allopurinol with lisinopril, combining these medications, severe allergic reactions and infections, right? Seek immediate medical attention if there's shortness of breath, swelling on the face. And then there's warfarin and fenofibrate again. There's fenofibrate, it's coming up again. First of all, is with the statin drug, and now is with warfarin. And it can cause, fenofibrate can increase the side effects of warfarin, the effects of warfarin, and cause you to bleed even more easily. So some of our seniors can have an increased bleeding, okay, or very intense bruising. If they just bump into something, they bruise really easily, not knowing that warfarin and fenofibrate can actually intensify that. Then there's other moderate side effects. Warfarin and rivastatin together, it might cause, once again, bleeding more easily. So this is already 2 interactions. Right here, they can bleed more easily. Once again, they can bleed more easily here. And drugs.com really lists out all the different things over here that you can take a look at. And these are some minor ones with warfarin and with acetaminophen. And then you get down to here, where is the drug and food interactions. Warfarin with food, right? You can take a look at, okay, while there's no need to avoid products like vitamin K, you should maintain a consistent level of consumption of these products. Foods rich in vitamin K is this, and this. Now, it's really important. What they're saying is that nutrition and diet, it can affect your warfarin, right? Increasing vitamin K levels in the body can promote clotting and reduce the effectiveness of warfarin. So people who are taking warfarin needs to know this. Now, a lot of doctors and don't have the time to really print out, these reports for their patients. And this is up to the patient themselves to really look at this and see what's actually going on here, right? So with this medication, alcohol can lower your blood pressure and add effects to this medication, because this is, I'm guessing this is a high blood pressure medication. Okay, so if you experience dizziness, da 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 da. Now, how many patients are taking blood pressure medications, but they're also maybe drinking alcohol? Okay, there's lisinopril, food recommendations here, gabapentin. Okay, so it can increase, alcohol can increase the nervous system. Like when you are taking these medications, a lot of these you should not be taking alcohol, okay, or consuming alcohol. All right. Now, here's some duplicate warnings, duplication, cardiovascular agents, and it's listing these here, affects the heart, right? So the key I'm making this video is when you have multiple medications and you don't know what the side effects are, and maybe your doctor never spent the time to explain it to you, drugs.com is a good resource to go online to read about it, how it reacts with your food, what kind of reactions could happen, and really bring it to the attention of your doctors and let them know, hey, this is what I found. What do you think? So that you are now more aware of what could happen. Okay, so I really hope you guys enjoyed this video, and I just want to make that awareness because I want all of our patients out there to be healthy, live a long, healthy, functional life, and hopefully that's the goal with all of you as well. Have a great day.